In the beginning, God gave us fruit and vegetables, that it may give us life. That's from the sun. This is Vitamin Health Awareness. Disclaimer. Vitamin Health Awareness. Website content is for informational purposes only, and it's not meant to replace the guidance of your licensed healthcare practitioner. Statements on this website have not been evaluated by the Food and Drug Administration. Information and products are meant for general use only and are not intended to diagnose, cure, treat, or prevent any disease or provide medical advice. Any decision to use supplements to support your specific needs should be considered in partnership with your licensed healthcare practitioner. Any questions you may have concerning your use of drugs, medication, or supplements should be directed to your healthcare provider. Vitamin Health Awareness customer service representatives are not qualified to answer any medical questions and will refer you to a medical professional. We're going to be talking about the benefits of vitamin D and vitamin D deficiency. But first, we're going to start off, what is the immune system? The immune system protects your child's body from outside invaders such as bacteria, viruses, fungus, toxins, chemicals produced by microbes. It is made up of different organ cells and proteins that work together. There are two main parts of the immune system: the innate immune system, which you are born with, and the adaptive immune system, which you develop when your body is exposed to microbes or chemicals released by microbes. There are two immune systems work together. Does a vitamin D deficiency affect your immune system? Vitamin D can modulate the innate and adaptive immune responses. Deficiency in vitamin D is associated with increased autoimmunity as well as an increased susceptibility to infection. The immune system defends the body from foreign invading organisms, promoting productive immunity while maintaining tolerance to self. Here are 8 signs and symptoms of vitamin D deficiency. Getting sick or infected, often fatigue and tiredness. Feeling tired can have many causes, and vitamin D deficiency may be one of them. Bone and back pain, depression, impaired wound healing, bone loss, hair loss, muscle pain, and there's also others I'm gonna say. Type 1 and type 2 diabetes, osteoporosis, cancer, glucose intolerance, autoimmune disease, skin aging, immune system, and cardiovascular. Vitamin D helps our immune system stay balanced during the cold and flu season and serve as a pharmacy resource. There are vitamin D receptors and activating enzymes on the surfaces of all white blood cells. Can you die from vitamin deficiency? June 23, 2008. A new study shows that people who have low levels of vitamin D in their blood had a greater risk of dying. During that time, 737 people died, including 463 from cardiovascular problems. Researchers found that people with the lowest levels of vitamin D in their blood had the highest chances of dying. Does vitamin D help fight viruses? Colds and flu. Cells lining the lungs can produce high levels of enzymes that convert vitamin D into its active form, vitamin D3. Indeed, in laboratory experiments, when these cells are treated with vitamin D3, they also produce small molecules that help protect cells from infections by viruses and bacteria. Vitamin D deficiency, low serum levels of 25 OHD, is prevalent in multiple autoimmune diseases. Because the vitamin D status is highly associated with the risk of autoimmunity, vitamin D has been implicated in prevention and protection from autoimmune diseases. I would like you to take a look at this video.
What we found was that after 3 months of taking either placebo, 1,000 units, 2,000, or 4,000 units a day, the actual dose that African Americans probably need to reach the target recommended by the Institute of Medicine is approximately 1,600 units of vitamin D per day. And that's vastly different than the guidelines issued by the Institute of Medicine, which recommend only 600 units a day for adults up to age 70. We have increasing evidence that higher levels of vitamin D, for instance, may be very important for improving survival from colorectal cancer. A lot of our research has suggested that colon cancer patients have much lower levels of vitamin D in the blood. So if we think that vitamin D is important not only for bone health, but also to protect people against these other chronic diseases, it may be very important to try and figure out what doses of vitamin D supplements people should be on to raise their blood levels. I think regardless of what your race is, it may be prudent to talk to your physician about whether it makes sense to check your blood levels for vitamin D. Because, for all of us living in the New England area in the wintertime, we don't get enough UVB radiation exposure from the sun to make any vitamin D in our skin. And so a lot of us, regardless of race, are deficient in the wintertime in the northeastern United States. So I think regardless of race, it makes sense to ask your physician about whether blood levels of vitamin D should be checked and whether you should go on a supplement to try and raise your levels to promote health.
What type of cancer causes vitamin D deficiency? A vitamin D deficiency has also been documented in patients with prostate cancer, ovarian cancer, as well as multiple myeloma. Larger randomized clinical trials should be undertaken in humans to establish the role of vitamin D supplementation in the prevention of these cancers. Does vitamin D protect against flu? Vitamin D supplements protect against acute respiratory infection, including colds and flu. According to a study, vitamin D supplements protect against acute respiratory infection, including colds and flu, according to a study led by Queen Mary University of London. What is dangerously low vitamin D levels? The most accurate way to measure how much vitamin D is in your body is the 25-hydroxy vitamin D blood test. A level of 20 nanograms millimeters to 50 ng/ml is considered adequate for healthy people. A level less than 12 ng/ml indicates vitamin D deficiency. If you don't mind, I would like you to watch this video also.
Growing up, our parents told us to drink lots of milk to build strong bones. However, the amount of vitamin D in milk doesn't come close to what we may actually need. So says Dr. Joanne Manson, Chief of Preventive Medicine at Brigham and Women's Hospital.
It's very difficult from foods alone to have adequate intake of vitamin D. The main sources of vitamin D are sunlight, ultraviolet light exposure, which causes the skin to synthesize vitamin D, and getting dietary intake through supplements or the diet.
The necessary maintenance of skeletal mass is highly dependent upon vitamin D and calcium, and vitamin D is necessary for the intestinal absorption of calcium from the diet.
Dr. Judy Glowacki is director of the Skeletal Biology Research Lab. She teamed up with Dr. Meryl Leboff, director of the Skeletal Health and Osteoporosis Center, for a study on vitamin D and bone health.
1 out of 2 women and 1 out of 4 men age 50 and older will develop an osteoporotic fracture in their remaining lifetime. And we found that 90% of patients admitted to Brigham and Women's Hospital had low levels of vitamin D that were not healthy for their bones.
The doctor's next research study will be to determine how much vitamin D we need to prevent fractures.
What we don't know is what the optimal vitamin D replacement is for adults.
We're hopeful that this will lead to new ways of preventing osteoporosis from even developing in younger people.
Dr. Scott Weiss, director of the respiratory division at Channing Lab, has been studying the connection between vitamin D deficiency during pregnancy and children with asthma.
We went on and did 2 birth cohort studies where we demonstrated that pregnant women who had lower intake of vitamin D were much more likely to have children who had asthma and allergies. We're going to enroll 760 pregnant women and randomize them to 2 groups, a treatment arm that's going to get 4,400 IU of vitamin D, and then just regular multivites in the control group. We believe that there's going to be a dramatic reduction in the wheezing rates in the first year of life, and that this will carry over to a reduction in asthma at age 3 to 6.
Finally, could vitamin D be the miracle drug that prevents many different diseases?
It is tremendously exciting to think that something as simple as taking a vitamin D supplement could have these myriad benefits of reducing the risk of cancer, cardiovascular disease, diabetes, autoimmune diseases, improve cognitive function, decrease depression.
However, Dr. Manson says much more research still needs to be done. That's why a clinical trial to test its influence on these diseases, as well as possible side effects, is so important.
There is a feeling that vitamin D may be more promising than many of the other vitamins and minerals that have been tested in isolation as single nutrients within a pill form. However, we still should be cautious before jumping on the vitamin D bandwagon.
What vitamin are you lacking if you are tired all the time? Being tired all the time can also be a sign of vitamin deficiency. This could include low levels of vitamin D, vitamin B12, iron, magnesium, or potassium. A routine blood test can help identify a deficiency. Your doctor may recommend taking supplements. What vitamin deficiency causes anxiety and depression? Magnesium deficiency has been linked to depression, anxiety, migraines, and high blood pressure. Is it okay to take vitamin D every day? Mayo Clinic recommends that adults get at least the RDA of 600 IU. However, 1,000 to 2,000 IU per day of vitamin D from a supplement is generally safe. Should help people achieve an adequate blood level of vitamin D. It may have additional health benefits. Does vitamin D boost immune system? Vitamin D helps our immune system stay balanced during the cold and flu season and serves as a pharmacy resource. There are vitamin D receptors and activating enzymes on the surface of all white blood cells. How long does it take to correct a vitamin D deficiency? The treatment dose of vitamin D depends on your age, how low your blood vitamin D level is, and what is causing the level to be low. Most often, your doctor will lower the vitamin D dose after 6 to 8 weeks of treatment. You will then stay on this lower maintenance dose for as long as you need. What is the best vitamin D to take? Our top picks: Nordic National is Nordic Naturals Vitamin D3 at Amazon. You can find it at Amazon. Provides 1,000 IU in a small capsule form. Then it's Nature Wise at Amazon, a great option For anyone looking to improve their vitamin D levels without taking a supplement daily, and it's Coltrate at Amazon, and Kirkland Signature D3 at Amazon, and Solgar at Amazon, and Mega Food at Amazon. And I'll leave a lot of these at the link below. And before I close, I would like to just say this. It's important to consult with your doctor to find out if you lack in vitamin D deficiency or even magnesium. It's important to consult with your doctor and have them check for those things, and tell them you need a test for vitamin D to find out, so you can correct your levels, because that's very important to make sure you take vitamin D every day at least. And I would like to thank you for watching this video. My name is Charleston Howard, researcher and minister. Thanks for watching.